My name is Rachel Sayre, and I'm the Heart Disease and Stroke Prevention Coordinator for the South Dakota Department of Health. I'd like to welcome you to our webinar introducing the recently developed South Dakota Team-Based Care Toolkit. During this webinar, we will walk through a demonstration of the actual resource to help familiarize you with the content and how to navigate throughout the online document. Now, before we show you this beautiful toolkit, I want to tell you a little bit about how this resource came to be. So in January of 2016, about 24 healthcare professionals began developing a strategic plan for statewide cardiovascular health. It was finalized and implemented in 2017, and the current version of this plan is what you see here. It can be found on the South Dakota Department of Health website listed at the bottom of your screen. During the process of developing the strategic plan, 4 different goal areas were identified as denoted by the different colored columns. Each of the 4 goal areas has a work group working toward the area's designated strategies. The first thing the priority populations group decided to focus on was promoting different models of team-based, patient-centered care. When gathering some background information for the strategy, it was realized that team-based care is still a relatively new and underutilized concept for South Dakota, and that there was still a lot of uncertainty as to what's considered team-based care, what different team-based care models are out there, and how team-based care can be incorporated into South Dakota's rural healthcare environment. So as a result, the Priority Populations Group decided to develop a toolkit around team-based patient-centered care, keeping in mind the specific needs of South Dakota's healthcare professionals and organizations. There were 4 to 5 individuals from a few different organizations that ended up providing direction, gathering information, and giving feedback to put this final resource together. The hope is that this toolkit will assist many more organizations to become more familiar with team-based care in general, the different models being utilized, real-life application strategies, and that each user will be able to incorporate something from the toolkit to either implement, improve, or expand upon team-based care within their own organization. This toolkit is a comprehensive resource designed specifically with our South Dakota healthcare environment in mind, and the diversity and knowledge of the individuals who assisted in creating this resource has been invaluable. So now, Mallory from the Emory Centers will give us a live demonstration of the different features of the toolkit.
Thank you, Rachel. Before we get started, I want to point out a few features of the webinar room. In the bottom left corner of your screen, you'll see a box called Web Links. These links will take you directly to the State Heart Disease and Stroke, State Department of Health Heart Disease and Stroke State Plan, and the Team-Based Care Toolkit. In the bottom right corner of your screen, you'll see a box called Handout. There you can download a PDF of this toolkit demonstration. Without further ado, I'd like to walk us through a live demonstration of the South Dakota Team-Based Care Toolkit. The toolkit lives on the South Dakota Department of Health website within the Heart Disease and Stroke Prevention Program. You can see there's a wealth of information here, and I encourage you to check it out, including the Heart Disease and Stroke State Plan. What we're looking at today is the Team-Based Care Toolkit. This toolkit was designed to be easy to navigate so you're able to find exactly what you're looking for without downloading a lengthy PDF document. Here you'll see the toolkit is broken down into 3 main sections. First, you'll see the introduction, which contains foundational content about team-based care in general. Here, you'll see different models of team-based care that go into detail about particular ways of doing team-based care. You scroll down the page, you can see tools and resources, which contain printable worksheets and conversation pieces around 2 essential elements of team-based care: getting started with team-based care and creating high-functioning teams. You'll see that you can also view additional team-based care resources, see the references from the chapter content, and get more information about upcoming webinars in this series. So let's dive in so you can get to know the Team-Based Care Toolkit. This toolkit was written using an easy-to-read question and answer format. Let's click on What is Team-Based Care in the introduction section to see what that looks like. You'll see when I click the icon, a web page opens in a separate window with the What is Team-Based Care chapter content. This chapter contains foundational information about the basics of team-based care. I'll quickly scroll through the document so you can see how the content is laid out. Scrolling back to the top of the page, you'll see there are questions listed at the top of the page under In this chapter. These are clickable links you can use to jump to specific pieces of content. For example, if you want to know about the patient's role in team-based care, click that link to jump right to the content. You'll see when I click the question, it jumps to that particular section in the chapter and it zoomed in on it. You can use the plus and minus arrows at the top of the page to zoom in or out to meet your needs. Let's go back to the Toolkit landing page by closing this window or by clicking the other tab at the top of the screen. I'm going to close this window. And now you'll see we're back on the Toolkit landing page. So let's take a look at the section, Why is Team-Based Care an Effective Way to Provide Care? This chapter goes a little beyond the basics and explains the benefits and challenges of team-based care and touches on the business case for team-based care. This chapter highlights examples of team-based care for improving blood pressure control and managing diabetes. And it also links out to some national case studies of team-based care in action. Again, you can either scroll through the section content or click the questions at the top of the page to jump to a particular section. Here, I'll click on How does team-based care work for improving blood pressure control? Again, let's go back to the Toolkit landing page. So I'm going to close this window. Now let's take a look at the different models of team-based care. The models that are highlighted in this toolkit are patient-centered medical home, the VA's PACT model, which stands for Patient-Aligned Care Team, Medicaid health homes, and a few other forms of team-based care. Let's take a look at the chapter content for patient-centered medical home. I'm going to click on the icon. Here you'll see the new window opened up with the familiar layout with the questions at the top of the page, followed by the content. I'll just scroll through here so you can take a peek at some of the content. Here you'll see a really nice infographic about what is a patient-centered medical home from the Patient-Centered Primary Care Collaborative. This is a one-pager that can be used as a conversation starter about PCMH, either with decision makers at your facility to start thinking about becoming a patient-centered medical home, or with patients if your facility is a patient-centered medical home. Again, let's go back to the Toolkit landing page by closing this window. And now I want to show you one of the coolest parts of this toolkit. For each model of team-based care, we collected stories from facilities in South Dakota that are utilizing these different models of team-based care. Let's take a look at the case study for PACT by clicking on the blue text in the PACT in Action in South Dakota. Be sure to click directly on the blue text to view this case study. For this case study, we interviewed Sarah DeCramer from Sioux Falls, VA. You can see that the case studies follow the same question-answer format as the chapter content, but has a more conversational feel. We're going to go back to the Toolkit landing page, again by closing this window. And I absolutely encourage you to explore these sections and check out the case studies on your own. They are excellent. I want to take a moment to say a sincere thank you to our case study participants. Erin Hartig and Katie Wick at Falls Community Health Center, Tammy Hoagie Lorenzen at South Dakota Urban Indian Health, Sarah DeKramer at Sioux Falls VA Healthcare System, Kathy Jedlicka at Regional Health Family Medicine Residency Clinic, Kelsey Rammel and Joan Fredrickson at Brown Clinic in Watertown, and Kyle Anderson at Avera Medical Group Family Health Center. The next part of the toolkit I want to point out to you is the Tools and Resources section. Here you'll find printable, actionable tools related to getting started with team-based care and creating high-functioning teams. Let's take a look at the Getting Started with Team-Based Care section. Again, similar format with the quick links at the top of the page. In this section, you'll find information on levels of team-based care, core principles and core concepts to guide team-based care, suggested steps to build a patient care team, and more. A quick scroll through the content shows that the content is laid out in easy-to-understand snippets. Let's go back to the landing page. And now let's click on the icon for creating high-functioning teams. Here you'll see examples of team member roles, a guide for structuring team huddle strategies, and guidance on dealing with different types of people in team meetings. Whether you're fully implementing a model of team-based care or just getting started considering incorporating elements of team-based care into your workflows, this information meets you where you are to help strengthen the way you do team-based care. Let's go back to the landing page one more time. And I want to point out the last few sections here at the bottom of the page. Here you can find additional resources on a wide variety of topics related to team-based care. So here you'll see it directs you to a page on the Department of Health website. And the resources are divided into categories. So we have general team-based care, communication, patient safety, pharmacy, primary care teams, South Dakota specific resources, patient-centered medical home, PACT, health homes, other forms of team-based care, and national case studies. You can click any of these links, which will either take you to a PDF or an external website to get more in-depth information on any of these topics. As I mentioned before, you can view a list of chapter references. These are the references from the chapter content. And finally, today's demonstration of the South Dakota Team-Based Care Toolkit is the first webinar in a series of 4 on team-based care in South Dakota. If you click on webinars, you'll be directed to a Department of Health webpage that lists the other webinars in this series. The registration is now open for the upcoming webinars. January 9th will be about types of team-based care, which will focus on patient-centered medical home and Medicaid health home, as well as touching on a few other forms of team-based care. You can register by clicking the link here. On February 13th, that webinar will be on patient and provider perspectives on team-based care. This webinar will touch on the return on investment for team-based care. And finally, March 13th, this webinar will be on realities of team-based care in rural South Dakota. This concludes the live walkthrough of the toolkit. We sincerely hope that you find this toolkit to be helpful. Thank you for going through the toolkit with me today, and I'm going to turn it back over to Rachel.
Thank you, Mallory, for guiding us through this online document. As you can see, there's a lot of really great information within this toolkit. But before we wrap things up, I'd like just to briefly mention again about those 3 webinars focusing on team-based care coming up in the next few months. Please plan on joining us for those as well if you're able to. Like Mallory said, the registration is listed for each of the dates, and the recordings will be posted to the site soon after those presentations. In closing, I'd like to thank you for joining us on this webinar, for your interest in expanding and enhancing team-based care, and for all the work that you do to help keep our South Dakota residents healthy. If you'd like to find out more about this toolkit, if you're interested in joining the Cardiovascular Collaborative, or if you'd like to discuss potential opportunities to partner on team-based care, please feel free to contact me using the information listed here. Again, thank you and best wishes.